Thanks to Richard and Diana and the organizing committee for inviting me here. And I'm humbled to be in front of the many patients in the room today. What I'm going to talk about today is what CVS is planning for treating patients who have kidney disease. And we've been thinking about this for only 2 years, primarily. I've been thinking about it for over 20 years, but CVS has been thinking about this for 2 years. And we are an official company called CVS Kidney Care for only a few months now. But we've been talking to a lot of the community. We've been talking to a lot of patients, a lot of you, a lot of key stakeholders within the kidney community. And we've recognized some challenges in the kidney care space today. And as we've been looking at those challenges, we've been thinking about how can we develop some products to solve for some of these challenges. And what you see on this slide is actually a very, very superficial look at some of the challenges that exist today within the kidney care space, especially for patients. And there's no way that I could get up here and talk about the challenges that each of you feel. But what we have heard, and we've also heard today, is many patients don't know they have kidney disease when they have advanced kidney disease. Some patients find out when they're in a hospital and they're told they need dialysis. We know that many patients find it very challenging to manage their disease. Kidney disease often coexists with diabetes and high blood pressure and heart disease, and sometimes heart failure. There are many different medications, many different physicians and nurses and social workers and dietitians that many of you have had to see. And patients are usually and frequently not given a choice about receiving a transplant, and often not given a choice about receiving home dialysis. So that means for us that we need to develop a program that's directed to improving consumer understanding, and I say consumer intentionally, and empowerment around your disease. We think the world is moving in a digital way, and we know that digital applications are going to be very important to help you. And we also think we can't lose that face-to-face component. So whatever we do for those important discussions, it has to be done face-to-face. And any discussions around transplant or dialysis modality, that has to involve face-to-face discussions, and oftentimes it has to involve care partners. So I'm going to go aside, just step aside just for a second, and I won't be too long. I know we're running short on time, and I'll look for Diana to give me the sign. But tonight I'll probably go to a restaurant. I will open up an app. I'll look for a restaurant. Maybe I'll choose American food. I'll search for what's open for the time that I want. I can go and find out reviews about that restaurant and choose a time and go there and get seated. Now imagine a world where if I wanted to go out to dinner tonight, I was given a phone number for American food. I called and they said, well, you can only get in 3 months. I can't find out what type of food they have, what type of reviews they have. When I go there, I have to wait. For how long, I don't know. When I sit down, the server stares at a computer and takes my order and never faces me and talks to me. That's what exists today in healthcare. We don't put up with that with ordering our food and going to restaurants, but that's what we put up with in healthcare today, and that has to change. Now, we also know that in addition to addressing some patient challenges, we're not going to make any progress, sadly, unless we also address some challenges on the payer side and also on the nephrologist side. I'm not going to run through these today, but what I will say is that we acknowledge that the economics have to work. And I think the administration is making the right moves to improve transplantation, to improve home dialysis, to improve patient education, and recognizing that in order to really change the status quo, then you need the economics to work for other stakeholders. That includes payers, but that also includes nephrologists. What I would like to say is, even though we're a company that's about 2 years old, our kidney care business, we have the assets of a very large company. And that makes what we're trying to do actually quite a bit easier at times. So if you think about it, we have about 10,000 stores, and 5 million people walk through our stores every day. Can you imagine the impact that might have on increasing awareness of kidney disease? We have 30,000 pharmacists who are happy to talk to you. I don't know of any other person in healthcare, any other professional, where you could walk in off the street without an appointment and ask a question about your health. Now, they may not spend a lot of time with you because they have other work to do, but they'll actually talk to you about your health and answer questions about a medication that you might be picking up over the counter, if that's going to affect my kidneys or not, without an appointment. We also have minute clinics. We also have infusion clinics. And we also have relationships with a lot of payers and health systems around the country. A little while ago, we acquired a small company called Aetna. They really know how to manage medical risk. They understand risk, and they understand about achieving outcomes for patients and lowering costs through better care. And we recently announced that we're expanding something called health hubs. And we launched a couple of these in Texas, primarily in the Houston market, where we changed what a retail store looks like and put 20% more focus on how do we manage chronic disease. And there's everything from durable medical equipment to places for education classes, even for yoga, and even for health concierge to help you through your insurance questions. And so we're opening up 1,500 more of those across the country over the next 3 years. We think that's also an opportunity to help patients with kidney disease. Now, the way we've been thinking about our new business is we're trying to create a solution that's end-to-end, meaning that we want to help identify patients who have kidney disease and don't know they have it, to also assist in the management of kidney disease, but also to become a dialysis provider. That's right, to be a dialysis provider with a focus on home, but also to get into device manufacturing, where we're actually making it a new device and taking it through clinical studies to allow patients to do more home hemodialysis. We believe PD is very important, but we also think that more patients can do more hemodialysis at home if given the right opportunity. I'm not going to talk about that today. I'm not going to talk about our provider development, our business development within the provider space today. I'm just going to focus quickly on CKD identification and management. So this is what our program looks like. And I'll take you through some of these, but what you see at the bottom of the slide is what you've already heard today. We want to delay onset of kidney failure. We want to slow progression of kidney disease. We do not want patients to move into stage 5 kidney disease. We don't want them to move into stage 4 for that matter. We'd certainly like to keep people off dialysis. We want to increase the number of transplants. We want to grow home modalities if patients do end up needing replacement therapy. And we want to increase the % of planned starts. That only comes with identification and education over time. And I think Richard put that nicely this morning. Now, how we're thinking about doing this is we do have a group of folks that are nerds. They're very smart nerds, and they deal with data all the time. And they're looking at all the data that we get in from either the pharmacy or through medical claims, and sometimes through lab claims and other data pulls that we can get. And they're able to not only identify patients who have kidney disease, whether they know it or not, but also identify patients who may be at risk of kidney disease and haven't been tested. And so we're developing programs on using that capability. And not just that, but they're able to identify patients who are progressing faster than others so that we might be able to intervene in a different way. And then we have a program we launched in April. We have renal trained nurses who are reaching out to those patients who have kidney disease and asking, how can we help? And I'll tell you a little bit more about that in a slide or two. We also think the face-to-face component is important, as I mentioned. There are certain conversations that you just can't have over the phone. I have 3 minutes. And we also think that digital movement is going to be very important for us to be successful as well, much like that example I gave you for wanting and choosing a restaurant for tonight. This is what our CKD program looks like today, with a nurse on the other end of the line who reaches out to a patient. And I could tell you it's not just focused on, do you know what your blood pressure is, and are you on an ACE inhibitor? It's a lot more than blood pressure. It's a lot more than controlling your diabetes. It's also empowering a patient to be more engaged in their whole health, to understand what some mental health challenges some people may have, to understand the impact of social determinants of health. How can we help you navigate through the health system? How can we help you ask the right questions when you go to see your nephrologist? And how can we make sure your nephrologist has all the data there so that they can make the right decisions? So we launched this in some selected cities back in April. We're expanding it. That was just a pilot. We continue to sort of modify our program and our analysis of the data. But this is what we've been seeing so far from our phase 1, again, launched earlier this year. So some of the big take-homes are, most people that we've reached out to have a nephrologist. That may change over time as we start looking at different data pools. Most of them have a nephrologist. Most people don't know what caused their kidneys to fail. Few have had any dietary counseling, although that seems to be one of the most important things on the patient's mind when they call in and talk to our nurse. Only some recall any conversation about renal replacement therapy. Most people think in-center is the only option. And everyone wants to include caregivers and spouses in the discussion. So those are just some of the learnings. At some point, we'll be able to give you more of a quantitative look at what you're seeing, but this is more of a qualitative review of some things we're hearing from patients. And I'll leave on this slide, and I'm not going to go into any details because Richard did talk about this morning as well as other speakers, other than to say that I'm pretty proud that, you know, even though we started thinking about this 2 years ago and the executive order only came out a couple of months ago, we're pretty proud that we line up quite well against many of the things that were in the executive order. And to us, that also means that CMS and HHS are thinking of the right things in trying to incentivize proper behavior in an industry where the status quo is no longer acceptable. Thank you.